The moment I realized I wanted to pursue medicine was actually going to the hospital to see my grandma when she had her stroke. And previously, before her memory was declining, for me personally, that's where I really got really intrigued by healthcare. I would say that a lot of my philosophy of care comes from actually being a DO, for being in what we used to call the osteopathic approach to patient care. And that is saying that, these things that constitute a patient, which is your mind, your body, and your spirit. These are things that are not separate entities, but they're sort of connected together. And that way I see that when someone is in pain, we are not also just talking about, physical musculoskeletal pain, but we're also thinking about like mental, emotional pain, and making sure that we address a symptom at many areas, because people are just as complex. And I think like keeping that in mind before you see everyone is like a huge part of like how I approach every person. When I see a patient for the first time, the first thing I want to accomplish is, what is your big concern? And I think that makes it easy for me to be, I can look at someone and tell them what are the things that I'm very scared and concerned about, but I want to know, like, in your life right now, what is the thing that you want to focus on? Why are we ordering blood tests? So you can do something in the future. So I think like the first thing I always want to emphasize is like, what do you want to do, and how is your healthcare helping you get there, or how is it obstructing you, and how do I help deal with that? Outside of work, when the weather is not 120 degrees, I love hiking. I'm a huge fan of the desert in general. So like Red Rock Canyon and like sort of hiking and scrambling in the area is one of my favorite things to do. My name is Dr. Christopher Nguyen. I am a primary care physician that specializes in senior primary care at Intermountain Health.